that it's better medical treatment in some cases, it has less side effects, and it should be covered under people's medical insurance, just as other medical treatment is covered. So we are all proud to have played a part in it, and I will tell you, like everything else in New Jersey, one doesn't get it through unless there are a whole group of advocates standing with you, behind you, or in front of you. And that's what some of these people did. So thank you. I shared this story when I met with some of the advocates a little bit earlier. My husband had lymphoma, and I can remember when, many years ago, when he had to first start the chemotherapy regime, and we walked into this room with all those things hooked up, and he looked at me and said, "I can undergo anything, but I'm not sure about this." And so if somebody had been able to give him pills, which I think we're going to hear from Dr. DePola, might even be better, a better way of treating the illness, certainly a much more comfortable way. So I just wanted to share that personal story with you.
Today we estimate that 1 in 2 men and 1 in 3 women will develop cancer in their lifetimes. Over 1.5 million Americans are diagnosed each year with cancer. That's more than 500,000 die each year. That's more than 1,500 people a day, more than 1 per minute. While these numbers do seem staggering, we've made great strides in the ability to diagnose, treat, and prevent cancer. We are now better able to ensure that a patient receives the drug that is believed to be most effective at a dose with the fewest side effects, as you heard earlier. Many of the new oral chemotherapy drugs have transformed rapidly fatal cancers into more manageable diseases.
As you all know, I'm a nurse, and I have a long history of taking care of patients. I actually worked at Memorial Sloan Kettering for a period of time. And back in, that was 1983 to 1984, and those were the days when it was mostly all chemotherapy was given intravenously. That was 20 some odd years ago. Now we can see a trend going toward oral chemotherapy, and you know, as a nurse, it's much more beneficial for the patient if it's given in the oral route, in the sense of you don't have the intravenous access, which causes infections, and it's more convenient for the patient. So with this bill, we're saying we should have the way we reimburse for oral chemotherapy should be the same way that we do it for intravenous chemotherapy.
It was a 3-year odyssey with a dramatic finish that I think really is going to, it's opening up a whole new door for not just blood cancer patients, which the Leukemia and Lymphoma Society represents, but all cancer patients across the state of New Jersey. Because of your efforts and commitment, New Jersey now joins the ranks of 14 other states and the District of Columbia to provide affordable coverage for oral chemotherapies, giving thousands of blood cancer patients in New Jersey access to life-saving, cutting-edge oral treatments like Gleevec and Revlimid.
I have a blood cancer. It's called myeloma, and myeloma is a cancer at this point that is incurable but very treatable. The problem with myeloma, though, is you become resistant to the drugs that you're already on. So I'm very thankful for this bill because I know sometime in my treatment I'm going to need to use every available therapy to keep me going. And with myeloma, a lot of times combination therapies, combining different drugs together, can overcome a resistance. And many of the combination therapies for myeloma involve oral treatments. And at present, well, before this bill was passed, those oral chemotherapies were very expensive. And even paying 10–20% of those bills, sometimes you just couldn't afford it. So now with this bill being passed, it makes it possible for myeloma patients to be able to use every type of chemotherapy available to them to keep them alive and going.
This law is about giving patients the opportunity to choose how they treat their cancer based on the best option available, not on what they can afford, which is so important. And cancer really doesn't wait for expanded coverage of new drugs and new treatments. and we should not ask families in New Jersey to wait either. So this law will make that easier. We can already see how it impacts firsthand here today. And I want to thank my co-sponsors as well. I know that Senator Munoz, you spoke already, but thank you for the support. And this makes a difference in all our lives for the state of New Jersey. Thank you, Senator.
And I personally, too, I want to thank the governor, who doesn't always sign bills that we pass, for signing this one and for making it law in the state of New Jersey. So, although I don't do that too often either, a big thank you to Governor Christie.